Cardiomegaly. After it was determined that the patient was suffering from cardiomegaly, the medical professional recommended additional testing to reveal if the enlarged heart was associated with heart disease. Rhinorrhea. The patient is experiencing the common cold that is accommodated with congestion and rhinorrhea. Hemostasis. When a cut is revealed, platelets are a major component of the blood that participate in hemostasis. Retinopathy. After looking at the blood vessels around my retina, the optometrist revealed I have retinopathy. Arteriosclerosis. Years of smoking eventually led to arteriosclerosis, which therefore limits the amount of blood that can easily be circulated throughout the body. Dysphagia. After her stroke, the patient suffered from dysphagia, so she had to visit a speech therapist in order to more easily eat food again. Sigmoidoscopy. After feeling extreme abdominal pain, a sigmoidoscopy was performed to determine if this part of the colon contained polyps. Hepatomegaly. After imaging revealed that the patient had hepatomegaly. After imaging revealed that the patient has hepatomegaly, additional tests will reveal the enlargement is associated with liver cancer. Final answer. Pancreatoma. My pancreatoma was removed after it was discovered that the large mass contained cancerous cells. Callopathy. Additional tests reveal that the patient has callopathy, specifically irritable bowel disease of the rectum. Ileostomy. The patient received an ileostomy as another means of removing waste from the body. Ascites. The patient suffered from extreme ascites that the fluid eventually started traveling from her abdomen to her chest as well. Meningocele. The baby was born with a small protrusion in her back that was revealed to be a meningocele. Bradykinesia. Her Parkinson's disease affected her movement, causing stiffness and bradykinesia, as well as tremors in the hands. Narcolepsy. Due to narcolepsy, I often find myself struggling to stay awake during important meetings, and I sometimes even fall asleep. Ventriculometry. A ventriculometry was initiated to get an exact measurement of the pressure in the skull. Pneumocentesis. A pneumocentesis was ordered to remove excess fluid from the patient's lungs. Hypercholesterolemia. The doctor prescribed statins to lower the patient's hypercholesterolemia. Ischemia. The doctor heard an irregular heart rhythm and palpitations, indicating possible ischemia. Bruit. I heard a bruit through the stethoscope when listening to the carotid artery. Lymphocytopenia. The patient suffered from an autoimmune disease that was associated with lymphocytopenia. Tachypnea. The runner experiences tachypnea and profuse sweating when she runs on the track. Final answer. Anhidrosis. The runner experienced a heat stroke during her race because she underwent anhidrosis, which kept her body from cooling itself. Echimosis. The discoloration and swelling accompanied with echimosis can be treated with continuous icing of the area. Esotropia. Patients with esotropia are often treated with glasses or vision therapy to help this type of strabismus. Positron emission tomography. After experiencing trauma to the head, a positron emission tomography was used to determine the severity of injuries, if any, to the brain. Petechia. My new medication came with side effects that include many petechia across my skin that are accompanied with a painful itch. Dyspareunia. It was revealed that the cause of her dyspareunia with her partner was due to inflammation of the vagina. Adipocyte. It was observed under a microscope that those with more body fat contain bigger adipocytes than those with less body fat. Arthroscopy. The arthroscopy of her sore hands revealed that the patient suffered from rheumatoid arthritis.